I'm Jessica Davis, and I'm a physician assistant here at Advanced Dermatology. I've always had a desire to help people, and I just think that's something that God has placed within me. Being able to help someone with a rash or acne, rosacea, any type of skin cancer, it's very gratifying to be able to walk into a room for a follow-up and to see that that rash is gone or significantly improved.
I'm Lauren Miller, and I'm a physician assistant at Advanced Dermatology. I became a PA because I love people in general. I'm a people person, and I love the idea of being able to make people feel better. I just have always loved dermatology and skin. I don't know, it's just always interested me. You know, I know how important it is to not only feel good but to look good, and so, you know, being able to help somebody look better and feel good about themselves, you know, really brings me a lot of fulfillment.
By design, physician assistants and physicians work together as a team. Physician assistants must work under the supervision of a physician. Physician assistants are trained very similarly to medical doctors, and because of that we have both diagnostic and therapeutic approaches, you know, to medicine.
We do a lot of the same training that a physician does. We go through the same curriculum that students do in medical school. It's just, you know, compacted a little bit into a shorter period of time.
When we first began working here, both Lauren and I, we spent several months right alongside Dr. Ray with her training us and just soaking in all the knowledge of her. So we very much treat things in the same fashion that Dr. Ray would.
I do review patients' charts every day that are seen by physician assistants. I review those patients' biopsy reports and lab work, and then the physician assistant and I basically come up with a treatment plan for each and every patient. I think our physician assistants are very knowledgeable, they're very bright, and they're very caring providers.
My role as a physician assistant is to be a dependent health care provider, and we're meant to be physician extenders, to be able to provide services to patients, to be able to spend more time with patients, to provide patient education in a way that the physician doesn't always have the time to do.
They see, you know, regular patients, they treat rashes, they treat acne, they diagnose skin cancers, they can do procedures, obviously, cryosurgery for warts or for precancers, they can do biopsies. They do a lot of surgical closures for me on my surgery days. They also do other procedures in the office. We have light boxes that we use for psoriasis, and they're in charge of treating the patients there. We also have an extract laser for psoriasis. Our physician assistants treat those patients as well. And then we have a treatment for precancers called photodynamic therapy, and they do that as well. I think that the physician assistants have really been a great addition to the practice because we are able to provide better care overall for our patients, and they've allowed us to let the patients have more access to our dermatology practice. They spend more time with the patients overall. I am stretched for time, and you know, we do have a lot of patients in our practice, so it just allows us to try to get everybody needs taken care of. We always, for every patient, want to provide the best dermatologic care that we can, and I think having 3 providers allows us to do that for our patients.
This is my dream job. I was so excited when I got the opportunity to come work here. It's a great environment. Dr. Ray is amazing. And like I said before, I'm a people person, so you know, the ability to be able to spend a little bit of extra time with the patients, I love just going into the room and, you know, chatting with the patients, you know, not just about how they're feeling, but, you know, about their families and how things are going with them.
It's always been fascinating just to see different types of rashes and be able to do things to help people. And a lot of dermatology patients are just self-conscious about rashes because they're things that people can see on the surface, and so it's just nice to be able to treat those things and see the results and see how happy patients are and pleased with the results.